Good day everyone, my name is Adonis Taliri, a student of Isabela State University, City of Ilagan campus. I am taking a Bachelor of Science in Nursing and I am a freshman from BS Nursing 1A. And today I am going to demonstrate the proper procedures and taking of the vital signs. But first, before taking of the vital signs, let us give a brief definition of the vital signs. Vital signs is also called a cardinal signs. Vital signs is the indicators of our health. Measurement of vital signs indicates the effectiveness of our circulatory, respiratory, neural, and endocrine body functions. Also, assessment of vital signs provide data to identify nursing diagnosis, implement planned interventions, and evaluate outcomes of care. Also, an alteration in vital signs signals changes in physiological functions and the need of medical nursing interventions. There are 4 vital signs which are standard in most medical settings. Number 1 is the body temperature. Number 2 is the pulse or the heart rate. Number 3 will be the respiratory rate. And the last one will be the blood pressure. Before taking off the vital signs, we need to perform the hand hygiene. We need to perform the hand hygiene before touching a patient, before clean antiseptic procedures, after exposure of the body fluids, after touching a patient, and after touching a patient's surroundings. We need to perform the hand hygiene to prevent the spread of microorganisms, infections, and cross-contamination. After performing the hand hygiene, we need to gather all the materials needed. We need to use alcohol and cotton for disinfection, thermometer for body temperature, sphygmomanometer, and stethoscope for blood pressure. Also, we need to use second-hand watch for pulse rate and respiratory rate. And we are going to use piece of paper and pen for documentation. But before using the materials in taking the vital signs, we need to assess to ensure that the materials is working correctly for us to get the accurate findings. Also, we need to consider the patient's condition and characteristics. For example, in the BP cuff or the sphygmomanometer, there are for pediatric patients and there are also for adult patients. So we should select one according to their characteristics. Use an organized and systematic approach when taking the vital signs. Just like this. Na yung magmamaling mo, sir, ano tinagan mo?
Gerald Banyan, sir.
In interacting with the patient, we should always use a language that he or she can understand so that we will gain his or her confidence. And if we gain his or her confidence, the patient will be comfortable to tell us every information that we are going to get from him or her. In taking the vital signs, we should know the usual range of the vital signs of the patients. So this will be our basis in taking his or her vital signs. Also, we should ask her about his or her medications, therapies, and medical histories. Anya adilas nga BP sir nung matandaan ng pa?
BP? 120/80, sir.
The first one I am going to measure is the body temperature. The body temperature is the amount of heat produced by the body and the heat lost by the body. There are two types of the body temperature. The core temperature, it is the temperature of the deep tissue of the body measured by taking the oral and the rectal temperature. And the surface temperature, it is the temperature of the skin, subcutaneous tissue, and fat measured by taking axillary temperature. Sige, sir, alaan ka temperature mo, sir.
Okay, sir. Sige.
Okay, the temperature mo kay 36.7 degrees Celsius. Normal lang tayo, sir.
Okay, sir. Sige.
The next one we are going to measure is the blood pressure. Blood pressure is the measure of the pressure exerted by the blood as it pulsates through the artery. Systolic pressure is the pressure of the blood as a result of contraction of the ventricles. And the diastolic pressure is the pressure when the ventricles are at the rest. Sir, alike mo iti blood pressure mo. Yata na kayo na nakamitin.
Okay, sir. Sige, sir.
Sabi mo lang, hindi mamit ko yun. BPM circuit 100/70 normal lang aja, sir. Ayan.
Okay, sir. Sige.
The next one to measure is the pulse rate. Pulse rate is regulated by the autonomic nervous system, and it is the wave of the blood created by the contraction of the left ventricle of the heart. There are 9 sites in taking the pulse rate of the body. Number 1 is the temporal, the carotid, the brachial, radial, apical, and femoral. Also posterior tibial, popliteal, and pedal or dorsalis pedis. Tata, sir, alay mo iti pulse rate mo, sir, ikabi mo yung mamito eh.
Sige, sir.
Ngayon, normal lang ta. 89 beats per minute. Medyo nakaratak lang ngayon kanya. Noise yung kitipas ko eh. Sige, ito mga. The last one we are going to measure is the respiratory rate. 1 inhalation and 1 exhalation is equals to 1 cycle or 1 breath. inalakkat saya di panaganis mo, ano ka partakkin ka ba yan? No, normal lang. Normal lang init amin.
Opo yun, sir.
Sige. Thank you.
Sige, sir.
Once again, everyone, my name is Adonis Daliri from BS Nursing 1A. Thank you for watching.